your support. Kung paano po natin ma-disseminate itong information that we will actually share with you so that in the interest of public health that this information will be disseminated correctly to the public para po ma-clarify natin yung mga concerns and questions evolving around the dengue vaccine and the dengue vaccination program. So, I will now share with you the press statement that we will release. Okay, so Sanofi Pasteur recently released a new supplementary exploratory analysis of the long-term follow-up of its dengue vaccine. This is part of the company's ongoing commitment to evaluate the long-term impact of the dengue vaccine and is also consistent with the recommendation put forward in the World Health Organization's position on the vaccine. These new findings demonstrate a different profile of the dengue vaccine for those with or without a previous dengue infection. In individuals who have been previously infected by dengue virus, there is a clear and sustained benefit of being vaccinated with the dengue vaccine up to 6 years following the first infection. In individuals following the first injection, correction. In individuals who have not been previously infected by dengue virus, there is an increased risk of hospitalization for dengue and severe dengue, predominantly grade 1 or 2 dengue hemorrhagic fever. Severe dengue can be categorized from milder to more severe forms of DHF1, 2, 3, and 4, according to WHO. DHF4 was not seen in those vaccinated. We have shared this new data in full transparency with the Philippine Food, Drug, and Administration and to the Department of Health. Furthermore, the severe dengue observed in vaccinated individuals was not clinically different from the reported in unvaccinated people in the studies. All study participants who got severe dengue, whether vaccinated or not, have fully recovered. So may I just repeat that statement? All study participants who got severe dengue, whether vaccinated or not, have fully recovered. Consequently, we are proposing an update to the current vaccine label to ensure that physicians can make appropriate vaccination decisions with their patients to enhance the impact of the vaccine in the Philippines, where majority have been infected by dengue by the time they reach adolescence. The company has also started to inform the new label proposal with private healthcare professionals to help them in the assessment of benefit risk of vaccination to their patients. Dengue is highly endemic in the Philippines, and since 2010, there has been a reported average of over 160,000 cases every year, mostly in children and in teenagers. Studies have shown that in individuals aged 9 to 14 years old, 9 out of 10 of them would have already been infected by the dengue virus. However, not all people who have been infected by the dengue virus are aware because around 75% of them do not have any symptoms. So this is actually the press statement that we have, and just to summarize it in 3 key points. One is new analysis of long-term dengue vaccine data from clinical studies found differences in vaccine performance in individuals with or without dengue infection prior to vaccination. Second, Sanofi is working with Philippines Food and Drug Administration to update product label to reflect the new information. And third, Sanofi has started to share this new data with all stakeholders, including private healthcare professionals, and is committed to keep on cooperating with the Philippines Department of Health, DOH, for its ongoing review of the public dengue vaccination program.
Thank you very much, Ms. Ching. Now, I would like to introduce again our head of Global Medical Affairs, Dr. Suping Nong, to give you the details of the new study. Thank you very much, and good morning, everybody. So I'm going to actually perhaps share a little bit more information that was already stated in the press release, because I know there's a lot of confusion, I know there's a lot of misunderstanding, and we really want to make sure that this information is clearly understood and that it can be communicated in the best way possible for the general public. So I apologize if some of the things might go over quite quickly, but we want to leave you enough time for Q&A so we can always come back if there's something that needs further clarification. So let me first of all start with dengue. It is actually known as a classical pyramid that you see here, that in fact of the 3.9 billion people around the world living in dengue endemic areas, this is half the world's population. Almost 390 million people are estimated to be infected per year. As Ms. Santos said as well, silent infections occurred 3 out of 4 of these cases. So, in fact, of the symptomatic cases, you might only see 96 million around the world every year. And of that 96 million, approximately 500,000 people are estimated to have some form of severe disease. And then of that 500,000 people, 2.5% of people could succumb to the disease. Now, this is really important to note because this understanding about the fact that dengue infection, 3 out of 4 of dengue infections may actually have had no symptoms, means that, any of you in the room here today would not know necessarily if you've had a dengue infection because of this very, very fact. Now, in the Philippines, however, we know that dengue is really, truly a public health priority. These are just estimates of over 150,000 reported cases per year, and we know that these are often underestimated. You see some data there about the trends that actually over the last few years and decades, it has been steadily increasing. And you also see the trends on the right-hand side, which talk about the dengue infection rates by different age groups, that in fact, by the time people have reached adolescence, actually a significant number of cases have already occurred. And on the bottom left, you see that all 4 serotypes are circulating here in the Philippines, and it can vary from year to year. Also on the bottom right-hand side, you see that there's a lot of seasonality. So it tends to occur with the breeding seasons because, of course, that is when the mosquito breeding is going to be most prominent. We can come back again to those facts, but this actually shows you as well, this is a truly complex infection against which to target to develop a vaccine. So, coming back to this point, is it true if you don't remember having had dengue infection that it means you don't have a previous infection? So out of a possible 100 people infected by dengue, perhaps only 25 might have had symptoms. So now let me just turn to what this vaccine update that we've just announced is. So just as a reminder, Sanofi has been working for over 20 years to try to develop dengue vaccine against a truly important public health burden. This has involved numerous clinical studies in 15 countries, so 25 clinical studies in 15 countries involving over 40,000 volunteers, and over 28,000 children, adolescents, adults have received at least 1 dose of the vaccine. The Philippines itself was involved in both phase 1, 2, and also phase 3 trials. And in fact, we specifically chose to have these trials in the most dengue endemic countries because that would be where the vaccine could demonstrate its biggest impact. All the studies, the efficacy trials, were also conducted under the governance of the US FDA. So US territories were also included in this trial. So what did the data show us? This is just a reminder of the data that was available at the time of the vaccine being licensed. So you see that in the age group 9 and above, Dengvaxia was shown to be safe and effective, preventing 65.6%, or in other words, 2/3 of any form of symptomatic dengue, 80.8%, in other words, 8 out of 10 of hospitalizations due to dengue, 93.2%, meaning more than 9 out of 10 of severe dengue cases in the 25 months from the first dose. Now we have continued, as per WHO guidance, as per our commitment, to continue to follow up all these participants up to 6 years following the first dose. And until today, if you look at the data in the population 9 and above, we continue to see significantly fewer hospitalizations and fewer cases of severe dengue in those who've been vaccinated versus those who have not, receiving the placebo. So this information up to the third year of the trials was used to actually gain the registration for Dengvaxia. 19 licenses have been granted. It has been launched in 11 countries and 2 public programs initiated, Brazil and the Philippines. This is the only licensed vaccine today that has demonstrated protective efficacy and safety for dengue endemic countries. The WHO and other decision-making bodies, public health decision-making bodies, have reviewed all the data and made their own assessments, and last year there was a publication of the WHO's recommendations. And to date, we estimate about 1 million vaccinees in the public programs. Having said that, we do acknowledge that there were questions asked of us as to whether or not the vaccine would have had a different performance in those who have had a dengue infection before or not. And if you go back to the original design of the clinical trials, these clinical trials were not originally designed to assess that question. These clinical trials, including the long-term follow-up, were designed to assess the question of long-term performance between the vaccinated versus the unvaccinated, but not necessarily long-term performance between those who've been infected before versus not infected before. So to answer this question, we had to really try our best to find a method to answer the question. And what we did was we identified an assay, a new type of laboratory test that would allow us to go back into the data, that would allow us to then, in fact, estimate of those who had received the vaccine, which ones of them had previous infection, which ones didn't have previous infection. Similarly, for those who received placebo, which ones had infection before, which ones did not. This assay was only recently validated. It was developed in conjunction with the Pittsburgh University. And only when this assay was available could we then use it to retest all the samples that we had from the clinical trials. So the new data is truly new. It was a retrospective, so going back into our data, using a new assay in order to answer this specific question. So what did it show us? And I'm repeating something which is of course already stated in the press release. Really clear benefit in those who have had a previous dengue infection out to 6 years, significant long-term protection against dengue, against hospitalization, and against severe illness due to dengue. However, in those who did not have a previous dengue infection, we noted in the longer term an increased risk of hospitalized and severe dengue in those who had been vaccinated compared to those who received the placebo. This was largely seen in the third year of the follow-up, from the third year of the follow-up. Now, with this information, we now have a better way to assess how to better use this vaccine so that we can indeed maximize its impact, because we can then use the vaccine in a more appropriate way in order to ensure that those who really, really need it should be receiving it. So this is why we have gone out, we have gone to the national regulatory agencies, we have spoken to the departments of health, and we want to make this information known so that it actually helps all the decision makers, the clinicians, make even better choices. It doesn't mean that all the data we've had today is no longer valid, because if you go back to the analysis that we already had, even without knowing the previous infection status, as I said before, in the highly dengue endemic countries, the majority of the people have already had a dengue infection. So our data still shows that out to 6 years, those who have received vaccine continue to have lower cases of severe dengue and lower cases of hospitalization compared to the placebo group. Now, I want to clarify something which perhaps is a bit misunderstood. What do we mean by severe dengue? Now, from the very start of the clinical trials, we had developed a criteria for severe dengue that was looked at by our independent data monitoring committee. These were very strict criteria that we developed, which in fact are actually wider, broader than the current way that the WHO classification for severe dengue is. These, on the right-hand side, are all those criteria used to assess severe dengue, and we deliberately chose this wider set of criteria because we wanted to be very conservative and we wanted to really, really dive very deep to assess safety. On the other hand, if you took WHO's 2009 classification for severe dengue, to meet that criteria, you would need to have symptoms such as severe shock, severe bleeding, and severe and impact organ failure or organ impairment. In our classification of severe dengue, you will see a number of symptoms which today many clinicians would actually not classify as severe dengue, but might classify it as dengue with warning signs that it could lead to a more severe dengue. The other way of looking at severe dengue, a different set of classifications many of the doctors here in the Philippines are very familiar with. This was a set of criteria designed in 1997, and it's still very familiar to doctors in Philippines. It's the 4 categories called dengue hemorrhagic fever 1, 2, 3, or 4. And you see these are just some examples of symptoms that are on this chart between 1, 2, 3, and 4, with 4 being the most profound and including potentially profound shock. In the DHF1 and the DHF2 categories, these are sometimes seen as more like bruising. There's a test that's done where they press on the arm and they see if there's actually bruising. They look at platelet counts, and then there may be some gum bleeding or bleeding from the nose. Now, what is also important to note that in all of the clinical trials, whether they were the placebo recipients or the vaccine recipients, all the participants who got severe dengue, according to, remember, our wider classification of severe dengue, they were all fully recovered. And what is really also important to note about severe dengue is that many factors may actually be driving some people to result in severe dengue and others not. In fact, we know that only 1 in 800 of dengue, whether it has symptoms or no symptoms, might actually result in a severe dengue. It's not known truly what are all the different reasons as to why some people might get it and why some people don't get it. But it has been noted that typically the second dengue infection is associated with higher rates. Not to say that all second infections result in a severe dengue, but just higher rates of severe dengue. So, when we take that clinical trial data and we try to put it into numbers that people perhaps can grasp a little bit better, what this shows us is in the population who had a previous dengue infection before, over a 5-year period, what you could see from vaccinating 1,000 of these individuals is a reduction of 15 hospitalized dengue cases and 4 severe dengue cases. So this is in those who've had a previous dengue infection before, and remember, it's the majority of the people who live in dengue endemic areas. In the minority, which is the people who have had no dengue infection before vaccination, vaccination over the 5-year period might lead to an increase of 5 hospitalized dengue cases and an increase of 2 severe dengue cases. Another way to try to put these numbers into context is to see even one additional severe dengue case amongst those who've never seen a dengue infection before. You would need to actually vaccinate 5,000 people, where 9 out of 10 actually have seen the infection before and 1 out of 10 hasn't. But if you vaccinate 5,000 of these people and 9 out of 10 of them have seen the infection before, in fact, in the whole group, you've prevented 17 severe dengue cases. Okay? That means, for instance, preventing 18 cases in those who've had dengue infection before versus the 1 case in those who've not had dengue infection before. Vaccinating that 5,000 gives you a benefit of 17 prevented cases. I can come back to those numbers again if you want me to clarify later. So, let me give you the summary. So when we look at the benefit-risk profile from this new analysis, we see 2 profiles, right? Very clear and sustained benefit vaccinating those who previously had a dengue infection before, so-called seropositives, potentially preventing 15 dengue hospitalizations or 4 clinically severe dengue episodes per 1,000 vaccinees. In the longer term, an increased risk of hospitalized and severe dengue in the vaccinated people without a prior history of dengue infection before they had vaccine. Potentially adding 5 dengue additional hospitalizations or 2 clinically severe dengue episodes per 1,000 of such vaccinees. With the majority, especially here in the Philippines, being those above and the minority being those in that category below, which means at the population level, when you translate these data, the overall benefit of vaccination in a highly endemic setting, such as we have here. In fact, here is an example where above 70% seroprevalence in those from 9 years of age. You've seen the other data that actually suggests 9 out of 10, at least 9 out of 10 of people, by the time they're adolescents in the Philippines, have already had a dengue infection. So this is truly still in line with the previous WHO recommendations on dengue vaccination introduction. So I think we can open to questions now.
Yes, thank you very much, Dr. Su. The floor is now open for questions. So please, we have mics on the floor. For those who would want to ask questions, please state your name and the organization which you represent. So yes, sir.
Okay, kakaroon po ngayon ng question and answer portion.
Good morning, I'm Rahul Danza, the Straits Times, Singapore. You said you are going to change the product labeling of Dengvaxia. Does it mean that you're going to recall products already being sold at pharmaceutical retail chains? How are you going to go about that change?
So far, with all the agencies that we've spoken with, no one has asked for a product recall. They have agreed with our proposal that we want to inform doctors through both a direct communication by letter, through medical education activities, in order that they are all readily informed of the new information. And of course, depending on each of the different ministries of health in the different countries, they can also issue their own circulars and memos to the doctors.
Okay, next question, please.
Hi, Sophia Cruz from Rappler po. When you were talking about the new findings, and you said that it went both ways, right? So for those who had prior infections, it was more effective because it increased the period to 6 terms. But for those without infections, it posed a higher risk for them contracting severe dengue. So are you saying that for those who had no prior infection, the vaccine was not effective?
So with this profile, what we would say is that today, if you know somebody who has no previous infection, we would not recommend vaccination. What is important to note, however, is that it depends on which country you might be in. It's sometimes not so easy to really identify, as I said before, who has had a previous infection, because you saw 3 out of 4 cases can have no symptoms. So given that, you have to look at local data, you have to look at local epidemiology, the burden of the disease in the country, to make an assessment of the what's called the seroprevalence. So what proportion of people living in a given country have had previous dengue? What we know from the data from the Philippines is that it's 9 out of 10, at least, who have had a dengue infection by the time they reach adolescence.
Dr. Santa Ana, would you like to add to the statement of Dr. Su?
I think nasabi na ni Dr. Su, dito sa Pilipinas, 9 hanggang out of 10 are already exposed. Okay? Hindi ibig sabihin nito na ito yung mga na-hospital na ng dengue. Sabi nga kanina, 3/4 of the cases are asymptomatic. So dito sa room na to, masasabi natin na around 3/4 we already had exposure to dengue, whether alam natin or hindi.
Okay. The lady in red, please, ma'am.
Lizel Once of DZRH po. Was Philippines a part of your clinical trial?
Yes, I think I showed the slide before. The Philippines was involved in clinical trials leading from phase 1 to phase 2 to phase 3. And as I also highlighted before, the phase 3 trials as well were all governed under the US FDA's governance for clinical trials.
Okay, if that was the case, then why was the Philippine government charged worth 3.5 billion for the Dengvaxia?
Sorry, may I ask, ma'am, to please repeat the question?
Yes, if we are a part of the clinical trial, why did the Philippine government pay for 3.5 billion pesos?
Okay. Actually, yung clinical trials are of course different from the commercial product. Just like any other study that is being done, whether here or in other country, yung study is a different process, and then pag na-license na siya, magkaiba rin siya. So, hindi siya magka-associate.
Okay, another question, last na po. If ever there would be reports about children who had side effects because of Dengvaxia, are you willing to pay for it?
Well, sa ngayon, just like we have mentioned, no, nagko-collaborate kami with the FDA, with the DOH, on the ongoing review. And in fact, we don't want to preempt that. Pero syempre, we are really a supporter and collaborator of the agency. No? So kung ano magiging action plan na nire-review ngayon ng DOH, ay nandun kami present. We will always support.
Thank you.
Okay, Cory.
Can I just add one point, about clinical trials and how much the vaccine research community in the Philippines has really contributed, not just for dengue vaccines, but if you take rota vaccine, you take HPV vaccine, pneumococcal vaccine, influenza vaccine, rabies vaccines. The Philippines have been involved with clinical trials to develop all of these vaccines. So it should not just be looked at from a dengue vaccine standpoint.
Okay, Dr. Rubay.
Just to address the other point, I think it's important for everyone to know that like DOH, safety is the top priority of this company as well. Our focus as of today is to communicate these results as proactively and as transparently as we can to FDA, MOH, to our Department of Health, and to all the doctors. But we are, rest assured, we are in collaboration with the Department of Health to make sure that the mechanisms are in place. And we will decide how to move forward with the Department of Health.
Good morning. To Ms. Ching Santos. Ma'am, kapag halimbawa nagdesisyon ang DOH na bawiin yung naibayad na nila, since we know na fully paid na rin po ang bansa natin. So pag nagdesisyon po sila na bawiin yung naibayad na, okay lang ba sa atin? Ano po yung gagawin nating step?
Well, una, wala pa tayo dyan, no? At sana hindi naman umabot sa ganun. Because just to reiterate the fact that the vaccine actually has its value, no? Sinabi nga sa atin ni Dr. Su kanina that ang Philippines is 90% of us are seropositive already, and the vaccine actually works best for seropositive. So, let's take it aside. Ngayon, yung sa DOH, as I've mentioned, ayokong mag-preempt ng kung ano man yung magiging decision ng DOH. Pero sinabi nga namin, safety is our first concern. Nanay din ako, syempre, di ba? So, kung ano man ang kalalabasan ng decision that the DOH will agree with, of course, our company will actually discuss with them and arrive at a win-win situation for the two of us.
For Dr. Santa Ana, para lang po ipaliwanag sa ating mga magulang, in layman's term po, Doc, ano po ba yung aasahan nila, tulad ng nabanggit kanina, na i-present kanina, yung severe na dengue. Marami po kasing mga magulang ang hindi masyadong maintindihan kung ano ba yung tinatawag nating severe. Pwede niyo po bang i-explain sa amin, Doc?
Alam mo, maraming salamat sa tanong na yan. Kasi even sa pamilya ko, pag uwi ko dito sa Pilipinas ng isang linggo, ang unang mga tanong sa akin, bakit nakaka-severe ang Dengvaxia? Okay, at ito rin yung mga agam-agam na naririnig namin sa mga magulang. Of course, we feel for the parents dahil lahat tayo halos dito ay magulang. Okay? Pero as what Dr. Su said, let us put it in the proper context. Ano ba itong severe? Okay? So, ang iniisip kasi natin na kapag severe, ito na yung dengue shock na mamamatay. Hindi. As ipinakikita dun sa analysis na ipinresent ni Dr. Su, ang severe could only be yung lagnat ng 2 araw. At kapag may suspect na case ng dengue, yung platelet count pwedeng bumaba. Pwede rin kapag nabunggo ka, magkakahimatoma ka. Okay? Or magkakapasa ka, at pwede rin parang pagka nainitan ka, magbabalingoy-ngoy ka. So, iyon, dun sa pag-aaral na yon, kinlasify na yon as severe dengue. Okay? So, nais kong iparating sa mga magulang na sana ay maintindihan nila kung ano yung tamang informasyon. At ito yung isa sa mga rason kung bakit nagdaos tayo ng media roundtable para maliwanagan. At paano maliliwanagan yung mga magulang? Sa tulong ninyo, sa tulong ng media, we are asking and counting on you to give the correct information to the parents. Kasi ang nangyayari ngayon, ang mga magulang natatakot. Hindi lang sa dengue vaccination at posible sa lahat ng klaseng pagbabakuna natatakot sila. And this will be very bad. Because alam natin na ang bakuna ay isa sa mga tool, public health tool, na magliligtas sa mga tao sa mga vaccine-preventable diseases.
So yung tulad po ng sabi niyo, like yung dengue shock, ganyan, bleeding, hindi po ito kasama doon sa sinasabi natin na severe, Doc?
Doon sa pag-aaral na pinakita ni Dr. Su, yung severe dengue, walang kaso ng dengue shock syndrome, walang kaso na namatay, at lahat ng kaso ng pinangalanan na severe dengue ay nag-resolve spontaneously. At ngayon, yung gravity ng ito na tawag na severe dengue ay hindi mas malala dun sa mga seronegative kumpara dun sa seropositive. Pare-pareho sila.
Last question po for me. Paulit-ulit po na tinatanong kung meron daw ho ba talagang namatay dahil sa dengue vaccine. So, ano ho ba ang gusto nating sabihin to dito? Thank you.
Actually, lahat ng mga cases no, ng adverse events or kahit anong reports are reported either to the FDA or to the DOH. And of course, this is best to be answered by the DOH no, for the public program. But as far as we know, as far as we are made aware, there are no reported deaths that are related to dengue vaccination. And this is assessed by an independent expert group, which is convened by the DOH, which is called the National Adverse Event Following Immunization Committee. And of course, we rest assured monitoring is continuing, and we are working with the DOH in collaboration to make sure that this is maintained.
Ma'am, sorry. Sir, sorry. Last, super last. Ano po ang reaction po ng Sanofi Pasteur dahil pinaiimbestigahan na po itong dengue vaccine sa DOJ?
Well, in line with that, well, of course, kami naman is a very responsible company. Transparent kami. In fact, the reason why we are actually releasing all these statements no, ng aming mga studies. At of course, if you will be invited, kung ano man ang data that we have presented to the stakeholders, to FDA, to DOH, ayan din ang ipepresent namin sa anumang ahensya ang magtatawag sa amin para magbigay ng information. Of course, we will cooperate.
Okay, thank you. In the interest of time at para makapagtanong din ang lahat ng ating mga kasamahan sa media, we will request you to please limit your questions to 2. Okay? Yes, ma'am.
I'm Sandra from GMA. How big was the exposure of the Philippines in terms of, because we have the figure of government, from the government, but I understand this has been available commercially and being used also by private practitioners?
Actually, sa public, of course, we know yun kasi sinishare naman ni Secretary Duque or ni spokesperson Lyndon Lisuy. But then for private, it is available among doctors. But today, we do not have any data because we are not allowed to actually keep any patient data for their privacy. So we do not hold any of those data.
Okay.
Meron kasing privacy yun eh.
And to Dr. Santa Ana or to you also, ma'am, how do you respond to criticisms that Filipinos were made to be like guinea pigs, eksperimentohan ng gamot po na ito? And kindly clarify the timeline. We have the clinical test and also the long-term test. Kailan po yun nangyari?
Actually, thank you for that question kasi gusto ko rin mag-express nung aking true feelings because of course I lead this company at ako'y Filipino, no. So syempre masakit 'yon na we're being accused because kung meron mang tao that actually will decide to protect my Filipino colleagues ako because even my children were vaccinated, just to let you know, and naniniwala ako na at this point in time halos lahat ng tao talaga ay exposed. Sa ganyang mga comments, of course na nakaka-feel ka rin ng lungkot. Kaya ang gusto talaga namin ay ipahatid sa lahat kung ano man yung tama talaga na based sa data para lahat tayo ay magkaroon ng unified information, tamang pag-intindi, yung right understanding of the data at para hindi magkaroon ng ganyang accusations or belief or mindset na tayo ay ginagawang test. Of course, it's not because this product has gone through rigorous tests. It has been developed over 20 years. The Philippines is actually one of those, as mentioned already, from phase 1, 2, and 3, which is really a robust study. All the documents were shared with our FDA and even WHO. At lahat po ito ay nasa kanila. And in fact, it's not just in the Philippines. There are like other countries that licensed and made it available in their country. So hindi po tayo nag-iisa. Dahil ang dengue ay isang napakalaking burden sa country. Kailangan din natin siyang i-address talaga para naman bumaba ang kaso nito.
Good morning po, I am
Sandali lang. Sandra, para lang mas malinaw pa, yung programa ng DOH ay hindi clinical trial. Ito ay isang public program. So, I think yun yung parang kalituhan ng ibang mga nagsasabi na ginawang guinea pigs ang mga Pilipino. Salamat.
Sir, ako po si Xander Cayabyab from DZMM. Ano po ang rekomendasyon ng Sanofi doon sa mga nabakunahan na ng dalawang administration? Itutuloy pa po ba yung pangatlo? Thank you po.
So I'm going to say this in English and maybe Dr. Ruby can translate as well for you.
Thank you.
So we know, of course, that this is causing anxiety for parents who have already started vaccinating their children. I think what you need to remember as well is that, as we've seen with the data, more than 9 out of 10 of people here in the Philippines from adolescents have already had a dengue infection before. Now, for those who don't know, truly don't know what their status is, the data still shows that overall, in highly dengue endemic area, the vaccine is preventing more cases, there's far fewer cases, significantly fewer cases of severe dengue and dengue hospitalizations in those who've been vaccinated versus those who didn't receive the vaccine. My son is 12 years old. He asked me, and we were talking about vaccines and how they act. So I'm speaking as a mother now. He said to me, so vaccines work like training your body, like immune system to act like soldiers, right, to fight infection. So in this case, 9 out of 10 of the people have good soldiers, and unfortunately, perhaps 1 out of 10 don't get the good soldiers and maybe allow the enemy in. Okay, but in this case, because severe dengue itself is rare, even if the enemy gets in, even if the dengue infection gets in, what we're looking at is over 5 years. If there's been 1,000 people vaccinated, only 2 additional severe dengue cases. So we're not talking about everybody who's been vaccinated, who has never seen dengue before, getting a severe infection. So that context has to be really put into the picture. So that overall, if you don't know the dengue infection status, overall you should be assured that living here in the Philippines with the high seroprevalence you already have, that the majority of people are going to benefit from the vaccine.
Dr. Rubay, would you like to add?
I think nagdi-disclose na rin lang sila, no? So I will disclose na rin. I also have a daughter who's above 9 who was also vaccinated. At katulad po ninyo, hindi ko rin din po tinis yung anak ko. So katulad rin po ninyo, dapat meron din akong concern kung ang anak ko ba ay nagka-dengue o hindi. Ngayon po, hindi ko rin alam. So is there a point to be concerned? Katulad po ng sinabi ni Dr. Su, majority po ng mga bata at 9 years of age, 9 out of 10 of them already had dengue, and 75% of these kids will not have symptoms. So wala po silang manifestation. Ano po ang ibig sabihin nun? Pag tinanong nyo sila, ang sasabihin nila, hindi sila nagka-dengue. Pero in all likelihood, lahat po sila nagka-dengue na. Diba? 9 out of 10 of them. So yung sinasabi po ni Dr. Su is that if you look at our data, even if you don't know kung anong status mo, at the end of the 6-year data, there is still benefit to getting vaccinated versus those that did not get vaccinated. So ang importante po dito is that individuals will talk to their doctors and check for their dengue exposure. So yun po yung pinaka-importante.
Okay. Yes, Ms. Cheng, would you like to add anything?
Kung okay lang, gusto ko sanang balikan yung question on the guinea pig question at saka siguro yung isang question about why did we ask the government to pay the 3 billion for the vaccine, no? So parang feeling ko lang magka-associate siya. So gusto lang nating i-clear that the DOH dengue vaccination program just started after we have licensed the vaccine. So ibig sabihin ng paglisensya is that we have completed all the phase 1, 2, and 3 studies, not just in the Philippines, but for other countries in Asia, and then also in the Latin America data. So lahat ng study nito ay pinagsama-sama, is-submit namin sa FDA, FDA accepted, and they licensed. And then of course, lahat po ng ito, lahat ng pag-aaral na to ay in accordance to WHO. So yung WHO actually played a very important role in actually convening all the regulatory bodies to actually have a uniform understanding and clearer understanding of this data. So hindi po siya ginawang guinea pig because the studies po are tapos na, and in fact, na-license na po yung product, which is actually the license that we need before we can go commercial with any product. Kahit naman hindi bakuna, kahit anong produkto, pagka na-license ng FDA, ay pwede na po siyang gamitin.
I think, ma'am, the previous question before, nababalikan lang natin, ang tinatanong nila is, kung ang isang pasyente ay nakatanggap na ng 2 dose ng bakuna, itutuloy pa ba, given this new finding, should the patient or should the parent decide whether to get the additional or to complete the vaccination dose?
Okay. So, all the data that we've seen from the very beginning of the phase 3 trials until today has been through completion of 3 vaccine doses. So, for those where we saw the benefit out to the 6 years and those who've had previous dengue infection, we don't know if they don't receive all 3 doses, will they get this benefit out to the 6th year? We don't know that because almost 90% of the people in the clinical trials received all 3 doses. On the other hand, if there were, let's say, a minority who had no previous dengue infection, we also don't know if they don't receive all 3 doses, could they actually end up being more harmed, being more dengue actually occurring in them because they didn't get all 3 doses. So, on balance, we know the data tells us that with the 3 vaccine doses, the majority of people are protected, whether you knew their infection status or not. The majority of people have fewer dengue cases, fewer hospitalizations and severe dengue. So we would suggest that, of course, parents should speak with their doctors to understand what might be the risks and the benefits if they were amongst the 9 out of 10 versus if they were amongst the 1 out of 10 who might not have the dengue infection. But in the end, we also believe that the benefit that we've seen was truly with 3 vaccine doses.
Dr. Rubay, would you like to add to that?
Karamihan po kasi nung mga subjects namin dun sa clinical trials, more than 90% of them have actually completed 3 doses. So ang sinasabi po ni Dr. Su, you only get the efficacy na pinapakita namin kung makukumpleto mo yung 3 doses. Ngayon, ang sinasabi niya is that yung risk kasi is hindi natin ma-identify kung hindi mo tinapos or tinapos mo. So ang decision is, do you go for 3 doses? Kasi ito yung pinapakita naming effectiveness ng vaccine. So this is a discussion that you need to have with your doctor, bearing in mind na yung risk na sinasabi namin for severe dengue is what we showed you. Yung DHF1, DHF2 in majority. So yun ang dapat na discussions that we are having.
Okay, we go to the gentleman here and then next will be Sheila.
Good morning po, Mongo Alves from TV5. Ma'am, follow up lang dun sa naunang question, no? Clarification lang. So paano po, o may dapat bang gawin or i-take yung mga nakakuha na po ng vaccine, especially sabi nyo nga po hindi alam kung nagkaroon na sila ng symptoms ng dengue before, pero meron bang dapat silang i-take para maalis lang po yung pangamba ng mga magulang? And second question lang po is, paano nga po yung mga nakapag-take na ng first vaccine? So you're saying na kailangan makompleto muna yung 3 kasi they are really alarmed on this issue po eh.
Okay, so yung first question po, anong gagawin nila? I think hindi nag-change yung the way you manage the disease because wala naman talagang vaccine that's 100% effective. Diba? So when your child has a fever, whether vaccinated siya or not, you still do the same thing. Diba? Kung maglinagnat siya, or any other symptoms na leading to dengue or you think is dengue, you still bring the child to the doctor. So it doesn't really impact yung management. So wala silang kailangan gawin as of today. Just bear in mind that you have these symptoms, which is the normal way that you manage the disease. And your other question is yung pag naka 1 dose. I think ito kasi has to be a discussion between the patient and the doctor because the doctor has to be able to assess individual level what the dengue exposure of the patient is kasi hindi lang naman siya, maraming paraan para ma-check ito, previous history, medical records. So kailangan kasi ito one-on-one discussion and of course after that, may explain ng doktor ano ang benepisyo at ano ang risk ng mga bakuna knowing that majority of the people are already infected by dengue when they reach adolescence.
Okay, Doc, would you like to add to that? Doc, okay na. All right. Sheila, and then we'll go to this side.
Yeah, I'm Sheila Chrysostom for Philippine Star. Is it stated in the contract of Sanofi with DOH that if any vaccine is develop complications, you're going to indemnify them or like shoulder the hospitalization. And according to the doctors opposing this vaccine, technically the study is not yet complete. So those vaccinated children should have been paid sort of trial fees. So what's your comment?
Before we go into the content, I'd like to address that little misinformation. No? Hindi nakukuha yung severe dengue from the vaccine. So hindi dahil nabakunahan ka, nagka-severe dengue ka. Hindi siya ganon. Nakukuha mo siya dahil you had a subsequent exposure to the virus. So hindi dahil binigyan ka ng bakuna, nagkaka-severe dengue ka. So you don't get it from the vaccine, you get it from a subsequent exposure to the virus. So i-clarify lang natin nun. Kasi akala ng mga tao, nabakunahan sila, ayan na, magkaka-severe dengue sila. Hindi siya ganon nag-work.
Yung dun sa first question about the terms of reference or the agreement with the DOH, of course, today it's, I think si Secretary Ducaran mentioned it in one of his interviews that it is now being reviewed by the DOH. Of course, we will have subsequent meetings with them. And we will, basta yung what is best to do for the public, yan ang gagawin namin dalawa.
I guess we need to answer the question lang, Doctora, that because Sheila's question, I think, is the vaccine, the studies for the vaccine is not yet complete. Is that your question, ma'am? Yes, Dr. Su.
I'm very happy to address that question. So, the design of the clinical trials went through a phase for efficacy and a phase for long-term safety. And these designs of the trials were following the WHO's technical guidance for the development of dengue vaccines, meaning any dengue vaccine to be developed should follow this approach. The data from the trials that were used to register the vaccine were after completion of the efficacy phase plus 1 year of the long-term follow-up phase. This data were reviewed by the national regulatory agencies and deemed as suitable for registration. In any vaccine development, there's always long-term follow-up, which also can continue 10 years or more. And sometimes new findings can even occur for old vaccines, even after decades that they've been on the market. So it is not uncommon, and it's part of our commitment to always monitor the efficacy and safety profile of all the vaccines that we have. So this is no different. These are new findings, findings that could not have been possible back when the study was originally designed, because we wouldn't have been able to tell the difference in those cases between those who had the dengue infection before or not. This data is new. It is only possible because we had a new assay. We went backwards into the data to assess. If we did not have this assay, we would not have been able to do this specific analysis. So any vaccine that is on the market that our company has, we have a long-term commitment. We always monitor ongoing efficacy and safety, and we continue to do that. If there are new findings, it is our responsibility to make that known, because we truly believe we want to make sure the best use of our products to ensure that they maximize the benefits and minimize the risk. And you will see that as a commitment for any vaccine that we have.
Okay, so Sheila, does that answer your question?
Yes, Secretary Duque said they are reviewing the contract, but do you have an idea, are there safety nets for the patients under the contract?
Sa ngayon, nire-review rin namin yung contract. Hindi pa kami napupunta doon, because today what we are collaborating with the Department of Health is, of course, one is to how to calm down the patients, bring the information to them. Kaya nakikipagtulungan kami sa DOH on how to reach them in their communities with information, with education materials, with questions to their answers. So I think nag-umpisa kami today to go to Region 3 para makapunta kami sa mga healthcare workers ng DOH at ng mga local government units para makatulong din sila na magbigay ng tamang impormasyon. So nandun tayo sa stage nun. Yan ay darating din. Siguro hindi today, pero masasagot din yung question na yan eventually.
Okay, ma'am.
Hi, I'm Teresa Serrahano from Associated Press. You said your long-term study did not address this issue. So would you say there was a flaw in your design, in the study design?
The original technical guidance from WHO asked for us to monitor in vaccinees what would be the long-term safety outcomes, which we had done. We designed it according to this. The question about whether a previous dengue infection would impact the performance of the vaccine actually came after. So when that question came, we had to think very, very hard to see how can we answer this question. And that was how we ended up working on a new assay, a new test with the Pittsburgh University, and then finally be able to use that test to go back into the study design.
So would you say you should have held off on administering this vaccine since the study was not yet complete?
Well, I wouldn't. So the long-term safety follow-up we committed to was out to 6 years. Based on the data that we had, and we have been diligently actually updating all the agencies, until today, without having looked at previous infection status or not, the vaccine continued to show benefit, meaning the majority of the vaccinees were receiving benefit, were being protected against dengue hospitalizations or severe dengue. So in the overall study population, we were still seeing an overall benefit. It's only with this new assay, new analysis, that you can now assess that perhaps there are two populations within the study, and that new information gives us new way to think about how to apply the vaccine, new way to improve the impact we want the vaccine to have.
Yeah, the trouble is this is being done in hindsight, and the children who had no previous dengue infection might be put to harm. So what do you do with them now?
So let me clarify again. The vaccine itself does not cause dengue. Vaccine itself does not give children severe dengue. It is dengue virus that does this. We have diligently done this analysis in order to answer some questions. And with this new information, we now know, of course, as well, that there are better ways to use the vaccine. Looking back at the children who've already previously received the vaccine, living in dengue endemic areas, we know the majority will and would receive a benefit based on the data that is truly coming from the clinical trials as well. What we also know, as Dr. Ruby said, is that no vaccine is 100% efficacious. So the same guidance would apply to anyone, whether they've been receiving vaccine or no vaccine, to look out for signs and symptoms of dengue, because actually early treatment can help and really does benefit the course of the disease.
Okay. Thank you so much, Dr. Su. We would love to entertain more questions, but I believe Dr. Su needs to fly to Geneva to actually meet the World Health Organization. So we will now accept last 3 questions. Yes, ma'am.
Yes. Cecil Lardizabal from CNN Philippines. Just follow up to that, Doc. Are you saying that you did not anticipate about the test that you're going to do just recently when you issued this in 2016?
I'm not quite sure. Could you repeat the question, clarify the question?
Did you not anticipate about the test? Because you were mentioning about, you just had a recent test, and that was the result that you announced it last week. Did you not anticipate about that in 2016?
You mean, did we not anticipate that we would see a different result?
Yes, and about conducting that test, that specific test that you were mentioning, the essay?
Well, with any research endeavor, there's no guarantee that you would have a success. We might not have succeeded in developing the right assay. If we had not been successful in developing the right assay, we would not have been able to even conduct this specific analysis. We conducted the analysis as a research endeavor. You have a hypothesis, and you have to test the hypothesis. And whether or not the findings are what you expected or not what you expected, for us, that we need to transparently share and disclose this information.
Okay. Another question. The Department of Justice just had a press conference. The VACC was saying that there were 3 alleged deaths linked to the Dengvaxia vaccine, and they named 3 children. Are you aware about this?
Let me address
Region 3 po.
the VACC concern. I think this is the main reason kung bakit namin gusto makipag-ugnayan sa media, no? Because this kind of information that is not validated, as I mentioned earlier, all adverse events or all reports of events like this are reported to the DOH and is assessed independently by the National Adverse Event Following Immunization Committee, and as judged to be all events as of today that we know of are not related to dengue vaccination. So our appeal today is that, you know, we try to correct this misinformation, kasi katulad ng sinabi ng mga kasama ko kanina, hindi lang ito mag-impact sa dengue vaccination, kundi sa immunization in general. Maraming mga bata, mga magulang na matatakot magpabakuna when in fact mag-benefit sila for the vaccine. Just to give a few details, no, dengue is in fact in the top 10 mortality in the Philippines. And if you look at the 700,000 kids that have been vaccinated, you would expect 14 deaths from these killed children if they were not vaccinated at all. Assuming na totoo yung tatlong yun, you still have a reduction of deaths, right? But my point is, hindi dapat tayo nagko-conclude on these things. Let the experts decide. No, there is an independent expert committee that decides on these matters. And as of today, what we know is that it's judged not to be related to the vaccination.
So let me just repeat that, Doctora. It has been studied by the NIFIC and was concluded as not vaccine related. That's what you are saying. Okay. Yes, ma'am.
Hi, good morning. I'm Ayi Makaraig from Agence France Press. Earlier, you've mentioned that the symptoms of dengue are hard to identify. So I wanted to clarify, is there a way by which we would know, based on the public vaccination program of the Department of Health, which children are now more at risk of suffering severe dengue? Those who have taken the vaccine but have not had prior exposure to dengue. So that's the first question. And second, what steps, what are the concrete efforts of Sanofi to help the families of these children? Thank you.
Let me take your first question. So unfortunately, there are no dengue diagnostic tests today that you could use in someone who's been vaccinated to tell if they had a previous infection before vaccination. Today's dengue diagnostic tests are geared towards diagnosing acute infection, meaning real infection in a patient. So the dengue vaccine already stimulates immune responses, so which means if you tested them, they would come out positive because they've been stimulated, the immune response. It doesn't mean that they've had dengue before or the infection before vaccination necessarily. So unfortunately, we don't have a test that can be applied today to go back and tell if someone has been previously infected. We have to go back to the facts. The facts that we know are 9 out of 10 of the individuals by the time they reach adolescence have already been infected by dengue. And that is probably the most reliable information we have, which is based on the seroprevalence, based on the epidemiology data that already exists here in the Philippines.
Siguro dun sa question on the responsibility for that, no? As I've mentioned a while ago, yung pakikipagtulungan namin sa DOH, in fact, anytime within the next 3 days, we have several meetings with them, including that of how to actually effectively communicate to the parents para mas matulungan natin ang situation to be more peaceful, ganyan, o matanggal sa mga parents yung kanilang fear and doubts. So, babalikan namin kayo, as you know, we have always been very transparent. Once we have all the actions in place with the DOH, of course, it will be shared, no? Just like any other data that we have. Gusto ko lang din bumalik dun sa tanong about the deaths, because I think it has been asked several times. Yung sagot ni Dr. Rubay, gusto ko lang idagdag na maganda din po siguro that we ask the DOH on their official answer para po mas ma-validate nyo yung information that we are giving you. At the end of the day,
it is them really that manages the report. So kung ano po yung sasabihin ng DOH, I think that is the final and official answer to that.
Okay, on that note, we are ready to get the... I'm sorry, ma'am, but we need to give a chance to other reporters also. So, sir.
Good morning, Greg Gregorio po from IBC 13. I just wish to clarify the DOH statement last week when they said that yung efficacy daw po ng Dengvaxia doon sa mga those who have been vaccinated without prior infection would only last for 30 months or 2.5 years, as compared to what you have been saying earlier, that those who have been vaccinated with prior infection would have 6 years of protection from dengue virus.
Yeah, they're speaking about two different profiles of the vaccine. So those who have had a dengue infection before clearly have benefited from the beginning all the way to the 6 years, okay, against dengue infection, severe dengue, and hospitalized dengue. In those who have had no previous dengue infection before, from the original publication of our phase 3 trials, in the first 25 months of the efficacy phase, we did see statistically significant efficacy even in those who had not had a previous dengue infection before. This new data is now looking back and looking also at 6 years of follow-up, and this new data that we're sharing today is just highlighting that in this specific population out to 6 years, we do see an increased risk of dengue hospitalization, severe dengue, in those who have not previously been infected. This risk is seen predominantly starting from the 3rd year from the first dose. And this risk is, as we said before, translating not into everybody getting a severe dengue. 2 additional cases out of 1,000 vaccinated over a 5-year period.
For those who have not prior infection, would you recommend having another shot of the vaccine before the time that they might have they might have the possibility of having a severe dengue?
It's a good question. We don't yet have all the data and all the answers about whether or not boosting. I think what you're asking is, could they be boosted? Hypothetically, it's a possibility, but we would want to have good data before we would advocate anything like this.
All right. Okay. As I mentioned before, we are very sorry because Dr. Su needs to leave for Geneva. I guess to close, maybe Ms. Cheng would like to give a last message.
Okay, so as I've mentioned in my opening, I really would like to thank everyone for coming. Salamat po sa pakikinig at sa pag-intindi. Because of course, as our partners in media, we actually appeal to you to actually share this information so that we can all help to pacify, to at least, calm down all the doubts and fear of our parents. No? Napaka-importante po sa amin na matulungan niyo po kami dito sa bagay na ito. And rest assured that our company, Sanofi Pasteur, is a responsible company. Kami po ay very compliant with all the compliance SOPs that we have operating under those. Nakikipag-ugnayan po kami ng patuloy with the DOH. Kami po ay responsible na makipag-ugnayan sa kanila. And whatever actions po na magiging next steps natin dito sa ating concern today, of course, we will let you know. But just to let me reiterate again that, ang importante po natin din tingnan on the other side is that the Philippines is highly endemic on dengue. Ang tagal na po nating naghahanap ng solusyon sa issue nating ito, na health issue na ito. And nakita po natin in another profile of the vaccine that it really works well, no? Lalo na po kung highly endemic ang country, gaya po ng Pilipinas. So we will still continue our legacy because our vision really is that no one suffers or dies from a vaccine-preventable disease. Maraming salamat po, mabuhay ang Pilipino. Thank you.
Thank you so much for attending. Refreshments.